Welcome. Thank you all for coming today. My name is Lynn Bonnet, and I am president of the Greater New Haven Green Fund. We thank Southern Connecticut State University's Department of Public Health for partnering with us and hosting this event in this lovely new community room. It is customary to acknowledge the indigenous cultures, the Quinnipiacs, that lived here prior to the arrival of the colonists. Now, we can also refer to this land as being part of the Quinnipiac bioregion. The Greater New Haven Green Fund is a nonprofit public charity that awards competitive grants for small grassroots organizations that promote environmental quality, public health, and equity in the communities in the Greater New Haven region. Since 2011, we have awarded over $800,000 in the form of 200 grants and sponsorships that engage and empower citizens and organizations to help create clean, healthy, and environmentally sustainable communities. One of our grants in 2017-18 funded a project at Southern to help decrease the use of single-use plastic water bottles on campus. Rebecca Pajinski, who was a graduate student in the Department of Public Health, collaborated with Southern's Office of Sustainability to study the barriers to using their reusable beverage containers program and the use of the hydration stations. The Office of Sustainability helped recruit participants for the study. Rebecca did educational outreach and held blind tasting tests to compare the tastes of commercially bottled water to that of the hydration stations. She promoted the use of the hydration stations. She offered a small financial incentive for those that used the reusable beverage container program. After 6 months, she surveyed the participants about whether they used the water filling stations and reusable containers. The final results were that 75% reported using the hydration stations, while 13% reported using the reusable beverage container program. While 75% thought that the water from the filling stations was safer, about 50% bought water on campus because they forgot their reusable bottles at home. For conclusion, quote, more research is needed on how to reduce single-use plastic water bottles on campus. Furthermore, 34% of the participants think recycling single-use plastic water bottles completely eliminates the effect of plastics on the environment, which calls for more education on the recycling process. And granted, this study was done in 2017-18, so almost 10 years ago. A few years before this project and the installation of the hydration stations around campus, Dr. Vincent Breslin was investigating the presence of microplastics in Long Island Sound. We will hear from him a little bit later. We now know that plastics are everywhere, including in our bodies. In 1950, 2 million tons of plastics were produced. After 2000, the pace accelerated. We are now producing around 400 million tons worldwide per year. Current predictions are that we will double this amount by 2050. I won't be here then, but many of you will be, and your children surely will be. We need solutions. I'm very much looking forward to learning from today's speakers. I hope that you enjoy the talks and find them useful. At the end, we invite you to share food and join in the discussion. We want to hear from you what you think, what stood out to you, and your ideas for how to move forward. Also, we have some wonderful student posters, presentations on their current work in this field. I hope you visit and engage with us. So let's get going. I'm going to introduce our next speaker. Dr. Annalene Njoku is a full professor in the Department of Public Health at Southern. Her academic and research trainings have focused primarily on community-based health promotion and disease prevention research at the local, regional, and international levels. She earned her Bachelor of Science in Public Health from Rutgers University, Master of Public Health from Boston University, and Doctor of Public Health from Drexel University. Her broad research interests include social determinants of health, health disparities, cultural competency in higher education, environmental health equity, and rural health, and the scholarship of teaching and learning. She currently is the chairperson of Health Equity and Anti-Racism Committee at the Department of Public Health at Southern, and has They agreed to partner with us to make this presentation today. So please welcome Dr. Amelia Mitchell.
Really excited about this event because we are bringing together community members. There's students in attendance from various institutions, both within Southern, University of New Haven, and area universities. And we also would like to provide insight into the effect of plastics on our health and our human environment. And I also just want to quickly acknowledge members of our department. We have our in the back. He has helped to provide a lot of support. We have some faculty members, students, alumni, public health alumni that are going to discuss this issue of microplastics and the effect of human health. And I also want to acknowledge that we had a microplastics and human health subcommittee of two Master of Public Health students, which I really want to acknowledge, Taryn Pierce in the back, as well as Tani Cookson Mohammed. They were really great at just helping to get this event together. So we are looking forward to hearing from the presentations from our speakers to provide insight into this really important public health issue. Then afterwards, we are going to have some networking, and we have some really great student posters as well that are going to highlight this issue. So we thank you for your attendance and taking the time to spend with us today, and we hope that you enjoyed this event today. Thank you so much.
So the next speaker is Dr. Vincent T. Breslin, is a professor in the Department of Environment, Geography, and Marine Sciences at Southern. He received his bachelor's in science in marine biology from the University of New England, which is in Maine, a Master of Science in Marine Environmental Sciences from Stony Brook University, and a PhD in oceanography from Florida Institute of Technology. Dr. Breslin teaches undergraduate courses in marine sciences, environmental studies, and coastal resilience Master of Science program. He is a co-founder and co-coordinator of the Connecticut State Colleges and Universities Worth Center for Coastal and Marine Studies. Dr. Breslin has received funding and published papers in support of laboratory and field-based studies examining the biogeochemical behavior of contaminant metals in coastal sediments and the consequences of microplastics in the marine environment. Please welcome Dr. Breslin. Thank you.
Well, thank you, and good afternoon to all of you. What I'd like to do is to share with you this afternoon some of the results of research that we did quite early on in the microplastic studies and microplastic issue as it developed in the state of Connecticut, and also to share with you some recent studies of other researchers who've been publishing work that talks about some of the issues we've already touched on in terms of degradation and contamination of microplastics in the marine environment. As was previously said, I'm going to talk specifically about microbeads, but microplastics are defined as plastic particles less than 5 millimeters in diameter, and going all the way down to submicron, nanoplastic sizes as well. So there's a large range of very small plastic particles. The microbead issue, when it first came out, was really looking at spherical polyethylene particles. And as Dr. White correctly pointed out, a lot of the issues with regards to different polymers are polymer specific in many cases. And the plastics that we were talking about at that point in time were polyethylene, and these were actually listed as an ingredient in these consumer cosmetic products that were being put to market at that period of time. And if you take a look at these are the range of products that were being marketed to consumers at that point of time. And the microbeads themselves were placed into these products to serve as exfoliants. So, as you washed your hands, you washed your face, it would exfoliate your skin, and then you'd rinse it all down the drain, literally. We used to, at one point in time, remember using pumice in soaps? They also used to grind up nutshells and use that. So we replaced what was perfectly fine materials, natural materials, and we used polyethylene microparticles, microbeads as a replacement for that. And I think part of that also is part of the marketing of these products. You know, if you look at these, you can see the little purple dots in there. Those are some of the microbeads in there. So it's part of the packaging in addition to part of the function of the product, which is kind of, well, you could call it ingenious. You could also call it other things. And in 2015, some researchers published a paper in Environmental Science and Technology looking at how we use microplastics or microbeads in the United States. And they estimated at that point in time that over 800 trillion microbeads were washed down drains in the United States every day. 800 trillion washed down our sinks and flushed into the sewer system every single day. And of course, it turns out that wastewater treatment plants are very effective at removing microplastics from the effluent arriving at wastewater treatment facilities. And many studies show, and we've looked at this, that we did some characterization of microfibers in particular in wastewater, but generally 95 to 99% of microplastics were removed from wastewater effluent as it went through the sewage treatment process. But nonetheless, that still leaves about 8 trillion microbeads that were being released into receiving bodies of water. Okay, and then many of those are rivers and streams or directly into estuarine waters that made their way out into Long Island Sound. Now, also, it was touched on in a previous talk, some of this, much of it is trapped in the biosolids, the solids that are retained. And what we often do is use those biosolids to recapture the nutrients through application to agricultural fields. So the work in terms of the consequences of those microplastics in agricultural soils is much needed and very timely. How did we get involved in this? Well, how did I get involved in it? You know, I was actually reading the New Haven Register one day in 2015, and they talked about the fact that the state legislature was considering the microbead ban at that point in time. And statements were being made like this, that there hasn't been any significant research with respect to microbeads in Long Island Sound, but they were confident that they're collecting within the Sound. And furthermore, environmental groups were saying things like, you know, that they're certain that they're probably having some sort of an impact in Long Island Sound. And so, you know, the one advantage I have is I've got some time, I've got students, we've got boats and access to boats. And we thought, you know what, we should go out into Long Island Sound and see if we can find microbeads that they're talking about. So we designed a study briefly that this is New Haven Harbor. And what you can see there is Sandy Point on the lower left corner. So it's the northern reaches of New Haven Harbor is where we decided to do some plankton tows to see if we could identify microbeads in the harbor. And we chose those tow paths specifically to go near the wastewater effluent discharges from the 2 wastewater treatment facilities that are discharging treated wastewater into New Haven Harbor. And so you can see the paths of the tows went basically proximate to or directly through some of those wastewater discharges. And that was by design because we were looking to see if we could find them. So, you know, we had some of our students go out and we used a plankton net. And, you know, and the plankton net has what we call a cod end there. And the particles that you collect basically congregate in that end of the cod, in the end of the net. You can unscrew that and pour it. And then we filter that and we examine those filters for the presence of microbeads. A couple of things. You know, when you do these kinds of studies, you know, we're actually looking at towing the plankton net right at the very surface of the water, because plastics tend to float in the water. So they're going to be in the very upper surface layers of the water. And, you know, a lot of the early studies were publishing all sorts of numbers about how many microplastics are in the ocean and in our coastal estuaries. And a lot of that goes back to methods. And this was talked about earlier. that the types, for example, even the pore size, the mesh size that you have in your net can influence how many microplastics you actually capture. There were a lot of, and these methods I think are still working their way through to try to standardize these so you can directly compare one study to another study. But anyway, what I'm showing you here are just simply the results from our study that was collected on that single couple of days where we did those plankton tows. And when you did that, we were only towing for a couple of 100 meters, filtering, not lots of water, but nonetheless, the very first tow that we pulled out of the water, we looked, in the jar that we poured the collection into, and you could see the microbeads, clear as day, in there. Very fine particles, but you could actually see them. And we did collect microbeads in each of the 4 plankton tows that we collected that day. And so when you do that, we wanted to take a look at what they look like. So you filter it out and you collect the beads on a filter paper, and then we took images of those. Now, we also used FTIR to take a look at characterizing the polymer types. So we can look at, we can compare a microbead that was collected on one of our tows in Long Island Sound with a microbead that we extracted from one of the specific consumer cosmetic products. Now, we're not going to indict that cosmetic product to say that that bead came from that product, because these beads were intermixed in lots of different types of products. But certainly the size, the shape, the polymer type, the pigments used are consistent with the microbeads found in those consumer cosmetic products. Similarly, the Biore material, this was another microbead that we extracted from the Sound. And finally, we could take a look at a third type, the different colors, the different shapes, different sizes, but all used in those consumer cosmetic products. So it was no doubt, so we were able to at least establish that there were microbeads in Long Island Sound, and that they were, probably coming from treated wastewater that was being discharged into the Sound. Although there are other sources, but these specifically from the consumer cosmetic products were likely coming from the wastewater. But I get this comment from students: for Professor Breslin, we found 28 beads. Why should we care? Well, it's not just about those 28 beads. Microbeads as a percentage of the overall total microplastic contamination in ocean water or coastal water is quite small. So just the presence of those small beads is an indicator of larger presence of microplastics, which we did not try to characterize in that study. We're only looking for the microbeads themselves. But there are a lot of other issues, and a lot of these issues were pointed out in the earlier talk of things that we're concerned about. I don't know if any of you have read Susan Frankel's book, Plastic: A Toxic Love Story, but one of the sentences in there that really resonated with me is this, and it gets to the point earlier. It's not the polymer, it's the types of chemicals and additives that are put into these polymers. So all of us now, even newborns, now carry traces of phthalates, fire retardants, stain repellents, solvents, metals, lubricants, dyes, stabilizers, antioxidants, fillers, fluffers, waterproofing agents, and bactericides. So these are the kinds of chemicals that are added to polymers to improve the performance of the polymer for its intended use. So, and not all of these go into every type of plastic, but certainly some of these go into many types of plastics, because you don't want your milk in your carton mildewing. You don't want water bottles, developing bacteria in them. So, you impregnate the polymer itself with these kinds of chemicals. That's part of the problem, and that's part of the what we see as human health consequences and natural world health consequences from the presence of these kinds of microfibers in aquatic environments. They've also published, conceptual models for trophic roots through these, feeding of birds and aquatic species in the ocean. And it's interesting, we've done some work and we looked at microfibers in oysters, bunker, because bunker swim through Long Island Sound, their mouths open, filtering plankton. And every place that researchers are looking for, regardless of the trophic level they're analyzing, they're finding the presence of microplastics in marine organisms. Whether that's at the surface layer or mid-water, or even now the sediments, we're seeing microplastics. At the surface, at the air-sea surface, microplastics, it's interesting, and it was alluded to earlier, that microplastics have, and plastics have the ability to serve as a sink for contaminants and also a source for contaminants. So once they're discharged into the environment, microplastics are known to sorb onto their surfaces things like pesticides, PCBs, metals, chlorinated hydrocarbons. Similarly, in the ocean water, in any water body of water, they can release additives to those plastics or other chemicals like styrene, nonylphenols, phthalates, bisphenol A. Some of these are endocrine disrupting chemicals. So we're seeing ecological consequences from the presence of these particles in our marine environment. So these particles can become hyperaccumulators of these chemicals in the surface of the ocean. And again, you put that transfer through food systems, and that becomes a route of exposure for ourselves eating seafood that may have been exposed to that. Also touched on in the earlier presentation is this idea of the release of chemicals over time from plastic. And this was referred to as the global plastic toxicity debt. And here you're looking at plastic additives, and in this case, they're looking at a polystyrene cup ring or a coffee cup. And the chemical additives to that polystyrene are shown as the colored dots in there. They could be phthalates or catalysts, plasticizers, flame retardants, or even the unreacted monomer itself. Over time, that begins to decompose. And as was correctly pointed out earlier, this could be over decades to hundreds of years, depending on the environmental conditions that it's subject to. But as that plastic begins to deteriorate and fragment to ever finer pieces, you're exposing greater amounts of the surface area of the plastic product, and you're releasing more of those chemical contaminants. Now, what this means is that x-axis there is a timeline. So plastics that we dispose, so if we were just to stop disposing plastics or introducing microplastics into the ocean today, we're still going to experience the consequences of the release of those chemicals from the fragmentation of those materials for decades and decades to come. Okay, and that's the plastic toxicity debt. So that's a concern moving forward. And ultimately how that will, the extent to which that contamination and the environmental consequences that result of that are as yet uncertain. More recently, this paper was just published recently, and this is microplastics in Narragansett Bay, so our neighbors just to the east of us. And what these researchers did was to look at microplastic concentrations in the sediments itself. And if you look at that y-axis of microplastic accumulation in particles per square meters, it's a little bit frightening. When you look at the concentrations from less than 20,000 to over 1 million microplastics per square meter is what they're finding. The other important thing to note here is they're co-locating with other contaminants in the sediment. So it's co-varying with other contaminants in sediments like metals, organic contaminants, pesticides, and so on. And so that's indicating perhaps similar sources for these materials. So wastewater discharges, for example, stormwater discharges, maybe primary samples. But you can also see it's correlated roughly to population centers. So in the southern part of the Narragansett estuaries, less contaminated than the northern reaches of the estuary, closer to Providence in areas. And so again, it exponentially increasing in urban areas. So what I expect is that, as time goes on, we may start generating similar kinds of graphs for Long Island Sound to look at the distribution of microplastics in the Sound. But, microplastics in the environment is still an evolving science because as was discussed earlier by Dr. White, the techniques we use to determine and actually count how many microplastics are there, what you count, how you count it, how fine you count it, can affect what your ultimate numbers actually are. So there's a lot yet still in terms of how we standardize methods across studies. And it's challenging to do that work now. To keep a clean lab that is plastic free to do these kinds of studies is very, very difficult without contaminating your samples. And so that's kind of an overview of how we got involved in some of what we're seeing out there now. But I'd be happy to take some questions. Well, cancers are one outcome of that. And so exposure to endocrine disrupting chemicals for long periods of time, I believe, is a known risk factor. Oh, yes. So in our studies, we looked at wastewater discharge. We were looking for microbeads, fibers, fragments. What else? Those were primarily the three types of things that you saw. What the major source now of a lot of microplastic contamination is the athletic wear that we wear. It's the polystyrene, and the fragmentation of those fibers through laundry or even just wearing it and abrading. And to go back to the point of atmospheric transport of these fibers, almost 90% of what we saw in wastewater from wastewater treatment plants were fibers.
Speaking of co-location of toxicants and the microplastics, is it because they are porous and they have some sort of charge attraction or something, or are they just co-locating, say, in sediment because that's the pattern of the water flow? I mean, what that co-location, why would the plastic attract these other?
Okay, a couple things that may be affecting that. One certainly is, what's the source of both of these materials? And certainly wastewater treatment plants are known to be a source of organic chemicals, as well as metals, as well as fibers and microplastics. So certainly coming out of the same pipeline is one. Secondly is, how vigorous is the water circulation within that area? Because if it's very vigorous water circulation, it could disperse that over a wider area through tidal or estuarine circulation. So usually in those areas, back here, you could say these are, upper areas of the estuary, probably quieter water. So it does encourage some settling of sediment and plastics and contaminants. These plastics do accumulate. They have the ability to accumulate on their surfaces, these contaminants. And again, as they fragment smaller and smaller, that increases the amount of surface area available for doing that. So when those plastics are also taking what may be dissolved in the water to the sediments with them. So there's the
soil particles do the same. Yes. And, I'm a toxicologist that study dioxins in the environment. But what would do the plastics actually have some sort of charge or something that would attract PAHs or something like that?
Yeah, they do have charged surfaces and they can't adsorb those chemicals onto their surfaces. So yes, there is a binding.
I'm wondering about septic systems. So we don't all have sewage in this state particularly. And I'm wondering, like, individual septic systems, are they filtering that? I know it's proximity to creeks and etc. But does that add a little bit of filtering?
Or even if you have a septic system, those plastics are probably trapped to a large degree within your septic system. But we know nutrients flow away from those septic systems, and the groundwater will certainly bring them with you. And these, depending on the size of these fragments and microplastics, I suspect that they would be transported away from those systems as well. But we get our systems pumped, right? And then that gets transported to a wastewater treatment plant and put through the system.
Thank you very much for an interesting presentation. And Dr. Breslin is at Southern, so I'm sure he's accessible for the guys that are here.